Hey everybody. I want to take a few minutes to talk about risk assessment and violence risk in the criminal justice system. Um, Risk assessment and violence risk are everywhere in the criminal justice system, from judges deciding whether or not a defendant or a suspect should get bond, to parole hearings for um, offenders who have already been in prison and are looking at release. We even do risk assessments when we would consider the release of someone from a psychiatric hospital, either whether they are considered a risk to themselves or others, or whether they have been committed due to being found incompetent to stand trial, or potentially due to insanity. Despite the fact that that risk assessment is everywhere in the criminal justice system, there are a number of challenges that are related to our risk assessment and how effective we are at conducting those risk assessments. One of the biggest challenges of conducting a risk assessment is trying to balance the needs to protect society versus the needs to protect the rights of the person who is potentially being civilly committed. Individuals who are at risk of potential violence to themselves or others have their own set of rights. Obviously, the Constitution lays out rights for us to be able just to essentially do whatever we want to do in the world, as long as we're not hurting other people. So you can imagine that if a judge writes an order saying that somebody needs to be civilly committed to a hospital, that might violate somebody's rights, particularly if that person doesn't feel like they are at risk of harming themselves or somebody else. One of the other big concerns for us when we're doing these risk assessments is establishing some sort of level of accuracy of our prediction. If we're overly cautious about being concerned about someone's level of risk, we may be putting people in the hospital that don't actually need to be there. Alternatively, if we're not conservative enough in our views, we may have people who are potentially suicidal or potentially homicidal who are out on the street and who end up hurting themselves or hurting somebody else. So we need to try to balance the needs of the individual and society while also being as accurate as possible in our prediction of that individual's risk level. Finally, one of the last things I'll say is, when we put folks in the hospital, there are concerns about how long do they stay there, what will be the criteria for their release. And so putting someone in a detention facility, either a psychiatric facility or some sort of outpatient commitment, can be a problem just for concerns we have about people's civil liberties and their ability to function in the world on their own without having the government kind of put limits on their behavior. When we're talking about civil commitment, I just want to kind of make sure this is clear in these lectures that you're about to hear. The biggest thing that you want to know is that civil commitment involves involuntarily putting someone in a hospital to prevent themselves from harming themselves or someone else. Civil commitment is typically initiated by a court, and that's usually a judge who writes an order that sends a person to the hospital against his or her will. Typically, people who get civilly committed have some sort of mental disorder that puts them at risk of harming themselves or someone else. And that mental illness may be some sort of psychosis, a manic episode as part of a bipolar illness. They may also be so depressed that they want to harm themselves, or that depression may render them unable to care for themselves, and they could potentially become psychotic because of their depression. So we're talking about some pretty severe forms of mental illness. Some examples of cases where you've heard about people who've been civilly committed are probably, if you've known anyone or heard stories about people who have gone to the emergency room because they were feeling suicidal and they were psychiatrically committed to a hospital for treatment of that suicidality. Sometimes you'll also hear about cases where people are threatening to harm other people, and a judge may write an order putting that person in a hospital to prevent that person from acting on their violent thoughts. Typically those cases are involving folks who are struggling with some sort of mental illness, and if we can get that mental illness under control, we can get them back out of the hospital and back home or back to wherever they are living. Typically, in my experience anyway, civil commitments to a psychiatric hospital for suicidality or something like that usually last only 3 or 4 days. 72 hours typically is a sort of a normal length of time for someone who has been civilly committed to a psychiatric facility. So that's, as we talk about these other lectures, I want you to kind of be thinking about that the civil commitment is really just sort of to protect society as well as the individual. And that should then kind of lay the groundwork for some of the lectures that we're about to talk about. Thanks.